Here we go.
Okay. Hello, everyone. We are group 4, and today we're going to be presenting our presentation on pediatric management of type 1 diabetes using insulin infusion.
I'll start with a little bit of background. The incidence of type 1 diabetes in pediatric patients continues to rise. Symptoms of type 1 diabetes include excess urine, excess thirst, weight loss, and high blood sugar measurements. Blood sugar measuring is typically done by a patient or a parent or a caregiver, and then administration of insulin will follow. However, this is changing to a system of insulin pump therapy. The advantage is that insulin administration is continuous and programmable and adjusts for changes in the body's requirements. Another advantage of insulin pumps is that they stop or suspend insulin when they recognize a low blood sugar, preventing a hypoglycemic episode. There are short-term complications for pediatric patients with diabetes, including hypoglycemic episodes and diabetic ketoacidosis. In addition, depression, anxiety, stress-related mental disorders, and eating disorders arise more in adolescents with type 1 diabetes than in metabolically healthy persons. There's a need to control type 1 diabetes and the complications from it. Long-term complications from type 1 diabetes in pediatric patients are an increased incidence of thyroid disease, celiac disease, hypertension, hyperlipidemia, neuropathy, retinopathy, and nephropathy. Type 1 diabetes has the potential to have a lasting negative complication throughout a patient's life. And now we're going to move on to the purpose of our presentation with Paulo.
The purpose is in pediatric clients living with type 1 diabetes, what is the effect of continuous subcutaneous insulin infusion compared with usual insulin administration on their glycated hemoglobin levels? Next would be methods.
So for our research, we utilize PubMed and CINAHL databases to gather articles on pediatric type 1 diabetes management, particularly focusing on the effectiveness of continuous insulin infusion pumps in improving hemoglobin A1C levels. We excluded articles published before 2018, those that were not primary research studies conducted in non-high-income nations, lacked relevance to nursing, or were not available in English. This focused approach ensured that the research findings were current, applicable to our topic, and aligned with nursing practice. So now we'll look at our results.
Okay, so 3 meta-analyses, 2 randomized trials, and 1 narrative review were included. 5 studies showed lower A1C, but only 4 had significant results using automated insulin delivery and closed-loop systems and CSII when compared with multiple daily injections or usual care. All 6 studies centered on the pediatric population. And to the right, you'll see our table. And next, we'll move on to our discussion.
In our discussion, there was good, reliable evidence favoring CSII use in pediatric clients with type 1 diabetes and lowering their A1C. Its implications direct nurses and providers to consider a CLS that includes both CSII and continuous glucose monitoring. Limitations were small sample sizes, diverse devices, and varying evidence levels. Next, we'll move on to conclusion with Rebecca.
So in conclusion, continuous subcutaneous insulin infusion manages A1C in pediatric clients with type 1 diabetes, and nurses should advocate and recommend its use. And for future trials, they should focus on automated closed loop systems and long-term outcomes. And that's all for our presentation. Thank you for listening.
All right, good job, everybody. Let me stop the recording real quick.